We have a KELSEY meeting that was kindly forwarded to me on my a comment on my blog, actually, that that we can watch. I didn't even know it was happening. Nobody I know knew it was happening. Let's see what this is.
I think we have just a couple more minutes before we're going to get started. And Patrick, we're going to have you take roll as soon as we get going here. Or excuse me, you may have another staffer doing that.
Only one person's wearing a mask.
Yeah, will do. Thank you. It'll be Sean Murphy, our committee assistant, who calls the roll, Madam Chair.
Great, thank you. Do we have Senator Byer?
I've not seen the senator join yet this morning, Madam Chair.
Okay, thank you.
By my count, it looks like as I mentioned, Representative Bossart Davis won't be able to join us because she's out of cell communication. So it looks like the members we are still waiting for are Senator Byer, Senator Boquist, Senator Gelser, and Representative Lewis are the ones that I have not seen on the line yet. So.
Okay, thank you.
So these are senators.
By the way, Madam Chair, we are live on OLA, so maybe we should go ahead and get started.
Okay, welcome everybody to the Joint Transportation Committee. And just to get started, we are having an informational meeting on quite a few items today as they relate to the upcoming sessions and also to some of the COVID responses and some of the COVID challenges that we've had. And Senator Byer and I have tried to put together an agenda that will give us all some more information that can help us with some of the choices and some of the challenges that we have in looking at our budget and looking at some of our future transportation types of projects and different things of that nature. Plus, ODOT is going to be here in force, giving some of the updates that we asked them to give on these occasions during our legislative days. And I want to thank all of the speakers who came today to be on our panels. We really appreciate you taking the time to be here so that we can have all the information and share all your thoughts and your concerns and ideas. So welcome and thank you for being here. So at this time, staff, could we go ahead then maybe and take roll of the actual senators and representatives?
Representative Bossart Davis.
She's excused.
Representative Evans.
Here.
Where?
Senator Finley.
Where?
Present by video.
Senator Frederick.
Also present by video.
Where is he?
Senator Frederick.
Oh, there he is up there.
Senator Gelser.
This is cool.
Representative Lewis.
I'm here.
Representative McEwen.
Representative McEwen, present by video.
Representative Witt.
Here by video.
Co-Vice Chair Boquist. Co-Vice Chair Noble.
I'm here by phone.
Co-Chair Byer. And Co-Chair McLean.
Here by video. So at this time, I believe we're waiting for about 3 or 4 folks. And so maybe Patrick, just to give them a little bit more time to call in, we could have you give us a description of the...
These lazy sons of bitches can't even make it on time to a meeting from their own house.
First panel, which is the Transit Safety Guideline Panel.
Thank you, Madam Chair. I'd be happy to. We have 6 folks who will be joining us on this first panel. It's the biggest panel of the day. All of our other panels have one single panelist. The 6 folks that will be joining us to discuss transit safe guidelines and budget considerations will include Karen Criswell, who's a Public Transit Division Administrator for the Department of Transportation. She'll be followed by Andy Howell, who's the President of the Oregon Transit Association, is also with Sandy Transit. That'll be followed by Aurora Jackson, who's general manager for Lane Transit District. And then we'll have General Manager Doug KELSEY of TriMet. And then we will go from there to Gary Bennett, who is a bus operator with Lane Transit District. And we will finish up with Bill Bradley, who's Executive Board Officer of Amalgamated Transit Union Local 757. That'll be the first panel.
Thank you. Thank you very much. At this time, did somebody just join us?
Oh, there's somebody. It's like he's in fucking Hawaii.
Senator Boquist.
Thank you, Senator Boquist. We're just getting started with the
Where's
first
this guy in the top
panel. And this is going to be the panel on transit safety guidelines as it relates to COVID-19 and also budget considerations that we may be having. So at this time, Karen, I believe you're going to start us off. Karen Criswell.
Come on, Karen.
Good morning, Chair, Committee.
Why are you wearing it?
You'd like to get out of my face covering?
If you're going to... Why are you wearing it at all if you're going to take it off?
This is Karen Criswell. I'm the chair of the Oregon, not the chair of anything. I'm the division administrator for the Public Transportation Division with ODOT. Get the opportunity to brief you on how ODOT and the public transportation industry have responded to and have been impacted by the coronavirus. Public transportation is a vital link and sometimes the only means for people to get to where they need to go.
Yes.
Under COVID,
yes. We don't need
public transportation has played a unique role by continuing to provide access to essential jobs, medical appointments, and other destinations. While at the same time, communities have asked for flexibility to use public transportation funds to deliver meals to high-risk people and older adults. We identified state funds that can already be used flexibly, and we've advocated for this flexibility with our federal funding partners. Providers are also asking for flexibility to use the statewide transportation improvement.
Hello. Come on.
Have varied by local conditions with some notable differences. From a statewide perspective, most providers have reduced service levels for a range of reasons, such as to better align with the local demand for service, to make sure that they could ensure the health and safety of staff and passengers, and or to address budget concerns. Budget impacts to providers have included increased expenses due to enhanced cleaning and sanitizing. Some have had temporary fare reductions or have gone fare-free in order to avoid handling cash. And in some areas, drivers are receiving hazard pay for their work. The experience in urban and rural areas has been quite different, with urban providers struggling to meet the demand for service while maintaining the physical distancing requirements. So, for example, if you have a 40-passenger bus, under normal circumstances, it's been reduced to around 10 to 15 passenger capacity in order to maintain physical distancing, which has put some increased demands on the system to be able to meet those demands. Transit providers in the rural areas also have this issue, but their buses are much smaller. So at times they are quite limited and may only be able to provide one ride to one person at a time. And I've already mentioned some of the challenges they face with PPE. On the 15th of May, the governor and OHA posted state guidance for transit service as counties started reopening. At a high level, the guidance included requirements that had already become best practices for most transit providers, such as posting the maximum bus capacity, marking off seats to encourage physical distancing, regular cleaning and sanitizing of points, and provision of face coverings for public-facing staff as well as for passengers who may not have them. As the state continues to reopen, transit providers will continue to face increasing pressure to balance the demand for service while still maintaining a healthy and safety environment for passengers. Next, please. In terms of funding, earlier this year, the the Federal CARES Act was passed, and it is providing nearly $286 million to Oregon transit providers, with $243 million going directly to small and large urban providers, and $43 million coming through ODOT to fund our rural and inner city transit programs.
All right, move this
And
forward.
should the I think what we'll do is after
I wanna hear
each panel, we will go ahead
Let's
and
hear Kelsey. I'm
we are
only interested in
recognized
Kelsey.
to a
in these
partnership
things.
with our local senior center and have been providing Meals
Oh,
on
who's
Wheels
she?
for the 4 days a week since the end of
Who's
March.
she? Is she Lane County?
This is actually a common realization in rural communities. Guilhem County Transit is another example. Guilhem went to Pendleton and the Dalles to purchase to-go meal containers and supplies for 2 meal sites. In the first week of this shift of service for them, they provided 55 meals. That number is risen to 125 meals this last week. In contrast, as I said, Mount Hood Express, which also is in Clackamas County, the closures of forests and parks and the recreation areas forced significant reductions to the Mount Hood Express service. The reduction to their service immediately put 40% of their service funding in jeopardy because they are federal funds with very strict guidelines in its use and their reimbursement base. So what you'll find as a common theme for transit agencies, which Karen hit on during this pandemic, is while our experiences are very similar in that we have all been tasked with implementing these safety measures for drivers and passengers, the implementation and the service and financial impacts vary widely. The one thing all agencies have in common is the need for flexibility in their funding sources so they can meet the needs of their communities. One example of shifts in budget impacts is with Grant County, known as People Mover. Since they use smaller cutaways, as also Karen mentioned, there's no back door for rear door entry. So they quickly and early on reached out to a local business and had them fabricate the shields for the drivers and installed on their vehicles. While they absorbed this cost, as well as increasing costs for the cleaning supplies and the PPE, they also are experiencing huge cuts to their non-emergency medical rides program due to office closures and canceled appointments. Those reductions have resulted in a loss of $12,000 per month for this agency, and that is funding that they use to match their federal funding. To remain reliable, Sunset Empire Transportation District did not reduce service, and they hired an additional 14 staff members to serve as sanitation technicians. They call them Sanitech, and they ride vehicles both for continuous cleaning of touch surfaces, but also to assist riders to maintain that physical distance that's needed. Sunset Empire, Clackamas County providers, Josephine County Transit, Chariots, and Salem, and likely others have waived fares in an effort both to help low-income populations, but also, as Karen mentioned, to reduce transmission of virus through cash handling and also to reduce the interaction of the drivers and the passengers. It's vital during this time that transit remain a dependable transportation option.
That's very nice.
As riders, as you've heard, all of our employees partly transformed taxes the April for FTIF
We
funds
want Kelsey.
to respond to the service demands existing.
I don't care.
Kelsey.
Okay, here we go.
Your data as well as all the information about your area and your service. At this time, we're going to go to Doug Kelsey, General Manager of TriMet. Welcome.
Well, good afternoon. Co-chairs Byron McLean, co-vice chairs Boquist and Noble, and of course all the members. Yes, my name is Doug Kelsey, and I am the general manager here at Portland of TriMet. Without a doubt, for us, these have been extraordinary times here when we look at an economic recession, COVID, combined with riots and protests all happening at the same time, all on a night basis. So,
Oh no.
they have been challenging times.
Oh.
What I would like to do, if I would just do a quick slide change, Sean, from the time I have available, and happy to answer any questions at the end. I've just laid out a few areas to frame this in. First, I'd like to give you an update, some context of what our agency has been doing and relates to COVID-19. I would like to then cover off a list of some of the actions we've taken. And now as we move to the next phases of the reopening challenges, I'd like to share with you some of the issues and perspectives related to those panels and how we're responding. And as others have referenced, we'll talk and refer to the budget impacts for us. And as part of your own deliberations, I've outlined a couple of comments for near-term assistance. So, if I may, so to the first topic, and I'll just keep it there. I think when I look at our industry, what's foundational here is trust. And safety for me is synonymous with trust with our customers. They get to choose when they're coming back, not us telling them to come back. We know we are an essential service for many, and as all of the individuals commenting here, we know we provide a foundational service for our respective geographic areas. But the hard part is also going to be attracting riders who have alternatives. We're seeing significant change in people working from home, ourselves included. So to maintaining the public's trust, I'll talk a little bit later about how Primate is actually doubling down on. Because we don't have trust, I don't believe they're coming, even if we gave away the system for free. I think like most agencies, hospitals, everyone else, particularly at the front end of this COVID
what did you just say?
Mid-March, we had serious supply chain challenges, getting PPE, getting sanitizers, base equipment for a really critical frontline staff. I'll tell you, even in the boardroom I'm testifying in here today with you, is we were literally making, my assistant and I were trying to make home sanitizer on my boardroom table because we couldn't trust the supply chain that it was delivering. So I think for all the reasons everyone's well aware of, we're in a very different stage now, I think, of that. The supply chain is showing better ability to deliver and meet the demand side.
See how he just talks and talks and doesn't say anything. I mean, he's very skilled at talking and saying nothing. I mean, he's not saying anything. Get to the fucking point.
Ridership for us, like others here and across the nation, about 70% normal on our bus and our MAX system, about 80 to 85% on our paratransit. On the
well, you canceled the paratransit system.
Down about 80%, or about just under $8 million per month. Our service hours, we reduced those by about 20%. For the bus system, about 9% for our rail network. Just for the committee, we have about 145 vehicles for our MAX light rail system and about another 10 vehicles for our commuter rail system. So each one had a different service formula, and we MAX system, for example, was down to 37% demand. So we identified a set of principles, and happy to share that with you later on, of how we are going to approach service reduction, and let alone the principles the agency was going to provide on service recovery going forward. But as we reduced it, we focused on areas of low income. It wasn't just across the board cut. We focused areas of low income and critical care pathways, our transit system to hospitals and or key educational institutions, things of that nature. One of the core principles were that we were going to cancel no lines. However, we maintained coverage for all. However, we did adapt frequency within that framework. The capacity on our buses, as we went to 6-foot distancing, like others have, was about 10 to 15 per bus. And that was just, that was on the edge in a lot of cases. We're trying to balance supply demand with the capacity side of 10 to 15 per bus. No layoff for us existed right now for our own private employees. This has been a high priority. We did have staff, a good of them who took advantage of the 10-week federal COVID leave provision. Many had to take care of their loved ones, their key family members, and in case they weren't well themselves. So we've also increased our so-called extra board significantly, so the operators at least get paid for at least half the shift, even if they're not driving in that specific day.
Where?
Very pleased to date, that we've only, out of 300,000 boardings typically carry on the system here in the street, we're down to about 100,000 like everybody else, 30%. We've only had one confirmed case of one employee out of about 3,500 with COVID. And great news is they've returned to work some weeks ago, so we know them and their families. So so far that result has been favorable for us. We want to keep it or be at 0 steps.
What happens when you get fat, man?
In terms of the actions taken, I would like to frame this into the start of this 4 key strategic priority areas. First, we wanted safety to be our number 1 priority. And one looks at safety not just in terms of the operation of the bus every day. We also have train crossings to upgrade, things of that nature that are short, medium, and capital investments on the safety side. So there are implications that it would be easy to stop that. We are not stopping those changes that we know are needed for ourselves and the public. So safety is the number 1 priority for us, and these get tested at times of financial duress. Secondly, remaining primate employment as much as we best can based on the financial capacity. The third assumption, strategic assumption here, is preserving our service levels to the degree that we financially can. And the fourth is maintaining financial flexibility as one of the other strategic cornerposts for us. That's not only in the immediate term, but we know we've been a benefactor, as some others have, CARES Act. At Primate here, we received $185 million.
Yeah, where'd that go?
But that short-term financial medication is going to run out. And so, and at some point, the strategic goal for me is to stretch out maintain our core service the best we can and balancing supply and demand, retaining jobs, and stretching this out till hopefully down the road, the recovery starts. I do know we're going to have to reduce service. Like, what I don't know is how far we have to fall. So the goal is to stretch this out, preserve cash, maintain safety, and all the principles I've outlined, and the hopes of balancing out to minimize our impact on all the parties I just outlined. So strategic flexibility, I kind of look at it like our financial oxygen. We don't have it.
He's just too long-winded. You can't follow what he's saying. He's kind of the perfect bureaucrat because he can go on and on and on and say nothing. But he just said he's going to cut service. You heard him. Nothing's being cut in this agency but service. You do know, people do know that, right? Everything else is going along as planned.
We can't breathe. So it's a really important foundation for us. And having worked for many years in the oil industry, this is a very foundational premise where they're tied literally to the price of the oil, up and down, and dynamic changes, where our industry operates somewhat like a semi-utility. And so we want to make sure we manage the dynamics of flexibility as much as possible. I would like to outline a number of steps we've taken to protect our passengers and the operators. I'll tell you, as I said at the beginning, it was a challenge at first getting the supplies our operators needed. They were bringing gloves in from home. They were doing other things. We were having masks made. My wife was making masks, in fact, the one I'm wearing here right now. It was all hands on deck, I think, as most people were going through to try and adapt to this new reality. Currently, we do have 6-foot distancing on our bus and encouraging distancing on MAX, including the operator. Our operators on streetcar and the train system, they're all behind the door, and which is great. I have authorized the completion of putting bus barriers on all of our buses. We have about 700 buses here. 50% was complete, and what we thought was the intended primary purpose of helping them maintain safety for operator assaults, spitting, things of that nature. It's now serving a purpose as for me, a supplemental guard for health from COVID. It's not a primary guard. I see it as a supplement one to using a face mask. So I've authorized $2.8 million to finish the remainder of the fleet. The remainder of the barriers arrives literally next week, and we'll be installing about 35 at a time here over the weeks ahead until likely the whole fleet is done by August. Again, part of this is not just for COVID-19. It's also there was H1N1, there was SARS. I suspect there'll be a COVID-20 or some version thereof. So this is intended to be not just for COVID-19, but for a long-term protection of our operators, but still moving as fast as we can now. We do have masks and sanitizers are in the back room, and a lot of supply is available now. But I have moved that there will be, in fact, we are providing masks to the general public now. We are doubling down, not only for our operators and our really important cleaners and frontline staff, fare inspectors, things of that nature. But we're putting them on all the buses, sanitizers on all the buses. Those people come on the bus, they can do a pump or so of whatever fluid is there. And if they need a mask, they don't have one from home, we have now moved into supply masks for our customers, let alone our staff. So I believe we are the first in the nation, and others are now following with that principle. One of the critical reasons for this is if we get to more and more tracing is occurring, I'm very concerned. I do not want transit in our agency, let alone in our state or as an industry, to be the intersection of lack of public trust. Because I think if we do lose this, it may be a half a generation before people come back. In national surveys already, 50 to 75% of the public is uncomfortable about coming back to use transit for the nature of COVID and the fear that comes with it. So we in TriMet have doubled down that we are going to provide the masks, we're providing sanitizers, moving to a standard of 4 hours or better cleaning on the whole system at great expense. But I think it's an expense we cannot afford to not pursue to ensure the public confidence going forward. Initially, I hired another 30 cleaners on the system, and now I'm in the process of hiring another 130 to move to the new standards for the governor's order of a 4-hour or better cleaning standards across our whole system of the rolling stock as well as our ticket vending machines for our smart card in particular. All the key touch points. In terms of helping out, we have some amazing operators out there, and we have been using those to delivering food for our Lyft customers because their service dropped by about 85% initially, and right now we've got 10 of them full time who do nothing but do home deliveries, going to the Safeways, the Fred Meyers, because they can't get out and for all the right health reasons. So 5 of those staff are driving full time. Also, TriMet staff for Meals on Wheels to give back to the community at a time when literally all the volunteers left Meals on Wheels in this region. So we've picked that step up to give back to the community and reframe how we might need to provide service here while we financially are able to carry them. Part of the new rules are that we would also look to remove riders with a demonstrated health problem from the system, and we will pay for alternatives such as Uber, Lyft, taxi to get on a rider. We don't want them spreading further germs, and this is operator discretion on the rest of the ridership. And so we will pay for alternative transport to transfer them to a hospital if that was their identified destination. Reopening challenges. We are moving to 3-foot distancing. And as I've indicated, we are looking to have 130 more cleaners. We'll monitor what that means. That's somewhere around $10 million a year for us at a time when financial challenges exist, as others have already outlined. But I think if we're going to be in this business for the customers who get a choice before we're out of business, I think these are sometimes expenditures we're going to have to make. And I may have to find savings elsewhere, but this gets to the core of public trust again, in my opinion. I think I've talked about the hand sanitizers, the masks already. In terms of the budget impacts on us, this is unfolding quickly. We're drawing down on the $185 million very quickly, but the key is we preserve this for the medium to longer term, because once this runs out, the goal is not to have a big drop. It's to minimize the drop until the economy catches up. Do not know how long that's going to last, particularly on the assumptions that we don't know what our revenues are actually going to be, what the state revenues are going to be. We have projections, but Wall Street doesn't even know right now. So I think they're still in very uncharted territory on what our fare box is going to be once we turn that back on. And I should comment that we have, like others, stopped collecting cash. However, we are encouraging our customers to use their smart card. We have many customers who use our smart card called HOP, who have yearly passes. So we want to keep that revenue going in because that revenue is connected where operators don't have to touch cash or handle it. It's in the individual taps, not the operators, and it allows us to maintain a sense of revenue coming in to the degree possible. So it's more of an encourage rather than enforce policy right now, but we'll take whatever dollars the public is prepared to share with us. because that translates into job and service level
You know, watching him.
in terms of near-term assistance, did have one comment that did come up. I would sort of reinforce as well and support the importance, I think, at this time to be able to use the STIF program to allow for flexibility for transit agencies while we're going through this period of volatility and turbulence, to have flexibility in STIF to allow the transit authorities to use it for their operating purposes. I would also suggest that this should not be permanent, but it should be a temporary way, so we can get back to the expansion of all the normal intents of what the wisdom of the legislation actually implemented for us. So we want to get back to as expansion as possible. Right now, we have paused our expansion. It's pretty hard to expand service foundationally at a time when we've already cut it back by 20 and 20+% in some cases, as we've indicated. So we are hoping this is temporary. We just don't know how long or the degree. So that flexibility of STIF would be greatly appreciated in your own deliberations at the legislative level. With that, I'll maybe stop and happy to answer any questions. All
right, that is complete boring piece of shit.
That would conclude my comments, Chair.
I don't know what he said. I was even distracted while he was saying. I mean, I can hardly listen to this guy. All I know is what I know. They're not going to cut anything at TriMet besides service. Okay, they're not going to cut capital projects. They're not going to cut marketing. They're not going to cut information technology. They're not going to cut government, whatever that baloney that Bottomley heads up there. None of that shit's getting cut. The only thing that's going to get cut is service. Okay, and that should tell you that's just more documented evidence of what government does and what it doesn't do. What it does is screw citizens. What it doesn't do is hurt the elites, because all the capital projects are still going to go forward. And who does that help? They'll follow the fucking money. Doesn't help any citizens. Okay, maybe there's a few jobs, but the big money goes to the Oregon elites. As you know, all that profit margin that's built in there is probably half of the contract is going to the elites, and all the people associated with them, all the engineers, all the planners, all of that, the entire system, which is running everything right now. These technocrats make sure they keep their funding. The only people that will suffer are the citizens, as always.